Hi, I'm Raychel Hamby. I'm the Director of Recovery at Cummins Behavioral Health.
And I'm Amanda Short. I am the SUD team lead.
And today we're going to be presenting about the link between mental health and substance use disorders. So oftentimes many people think that mental health and substance use is very separate issues and that you treat mental health and then you would treat substance use or vice versa. But actually they often share common similarities and have underlying issues such as genetics, brain chemistry, and trauma and stress. And so it's really important that you address both at the same time because substance use disorder can exacerbate mental health symptoms, and mental health symptoms can also exacerbate substance use disorder. And so it's very important that you address them simultaneously, utilizing effective treatment. And so we're going to talk a little bit about some statistics about substance use and mental health disorders. And so right now there is 62.4% of individuals who've received treatment for both substance use and mental health disorders. That is any mental health disorder. And then there's also those who have serious mental illness and substance use disorder. And that statistic is about 75% of individuals who also engage in treatment that have substance use and mental health disorder. And then we also look at our adolescent population, and that statistic is 71.5% of individuals also receive substance use and mental health disorder treatment. As you can see, this is a pretty high statistic, and that most people do struggle with both substance use and mental health disorders. So we're going to talk a little bit about the symptoms of what is a mental health disorder. So when I'm speaking about mental health disorders, I'm talking such as anxiety, depression, trauma. It could be any personality disorder, anything that someone is struggling with mentally at that time. And so symptoms that you're going to kind of see are some mood changes, of one that most people see most often. So from mood swings, they're very irritable. And as you can see, the next symptom there is anxiety. So that is very persistent worry, fear, or panic, as well as cognitive issues. So difficulty concentrating. They could have memory problems. They don't remember what they did yesterday. They don't really want to remember. There's also behavioral issues. So they withdraw from social settings. They avoid family and friends. And so there's not a lot of wanting, which is part of that isolation, not wanting to go out and do things that they want and love to do, engaging in recreational activities. And then also you have physical symptoms, which is your change in your sleep patterns, appetite. There could be weight gain or weight loss. And then those energy levels could fluctuate because you could have an over large amount of energy, and or you could have no energy where it's very hard to get out of bed every single morning. And so when you look at our substance use disorder symptoms, these are kind of similar as well. So you have a lot of psychological issues you can see. So you have mood swings, paranoia, anxiety, periods of unusual hyperactivity, or could also be the opposite, unusual periods of very low energy, not wanting to get up and do the daily activities. There is social impact as well. And so upon, there's a lot of drop in attendance with school and work. They have low performance. There's changes in their friends and their hobbies. And they have a lot of legal issues often related to substance use disorders because they are putting themselves in risky situations that then lead to criminal justice involvement. We also have behavioral changes along with the substance use disorder. So you have people that are very secretive in their behavior, they have frequent trouble, and they engage in risky behaviors, which is related to the criminal justice piece. And then there are also the physical symptoms. So bloodshot eyes, sudden weight changes, as you saw with the mental health side, which could be weight gain or weight loss, slurred speech, and impaired coordination. So not being able to do a lot of mind-body coordination, stumbling, things of those natures that you would see with someone who's under the influence. So when you look at the combined symptoms, they really come together, and it's very hard sometimes to see the difference between is someone struggling with a mental health disorder or a substance use disorder, because sometimes they can look very much the same. And because of that, it's really important to look at the complexity of the diagnosis, so that if you don't address the mental health disorder and you're only addressing the substance use disorder, you can miss some mental health pieces that could help that individual in their long-term recovery. And or if you don't address the substance use disorder, it could be exacerbating some symptoms that would potentially resolve if you were to treat the substance use disorder. So that's why it's really important that as you continue to look at symptomology for those who struggle with mental health and substance use, that you really treat both sides of the issue. So that way you can have more effective treatment and better outcomes for care. So now we're going to go into what are some of the causes for substance use and mental health diagnoses.
So, the causes of dual diagnosis symptoms, where an individual has both a mental health disorder and a substance abuse disorder, are multifaceted and interconnected. There are 5 key factors. We have genetic predisposition, environmental, psychological, behavioral, and socioeconomic factors. When looking at genetic predispositions, we first look at family history. Both mental health disorders and substance use disorders can run in families, suggesting a genetic component. We also look at biological factors, which states certain genetic traits may make individuals more susceptible to both conditions. The second factor is environmental factors. First, there's stress and trauma. Exposure to chronic stress or traumatic events can increase the risk of developing both mental health issues and substance use problems. We also look at social environment. Living in environments where substance use is prevalent or where there is limited access to mental health care can contribute to dual diagnosis. The third factor is behavioral factor. First, we look at coping mechanisms. Substances can start as a way of managing symptoms of mental health disorders, but over time it can escalate into addiction. We also want to look at those risk-taking behaviors. Mental health disorders can lead to increased risk-taking behaviors, including substance use. Our fourth factor, socioeconomic factors, looks at access to care. Limited access to mental health and substance use treatment can exacerbate both conditions. We also want to look at economic stress. Financial difficulties can increase stress and the likelihood of substance use. Our last factor we look at is psychological factors, starting with self-medication. Individuals with untreated mental health disorders may use substances to cope with their symptoms, leading to addiction. Also want to look at brain chemistry. Mental health conditions can alter brain chemistry, making individuals more susceptible to the rewarding effects of substances.
So when we look at all of the things that we kind of talked a little about when we talked about symptomology and causes, it's really important that we address the whole person holistically and making sure they get into the appropriate level of care. And so dual diagnosis treatment can look different based on the individual's mental health disorder, including their substance use disorder, and kind of what level of care is most appropriate for them. And so again, as you're looking into treating an individual who has both substance use and mental health disorders, you want to look at integrated treatment. Somebody that's going to be doing simultaneously care where you're addressing both at the same time, but also within that having a multidisciplinary team. So that can look very different based on each client that is being served. And so that could include a medical provider that is in providing MAT treatment, so medicated assisted treatment for recovery, which could be related to their substance use, and or mental health medication for addressing their anxiety, depression, any of the paranoid delusions, anything that really is going to help them in their long-term recovery. Then you also want to look at having maybe an addictions counselor or therapist that is very group specific. So helping them address their substance use disorder in a very specific group setting that kind of helps build the recovery knowledge and helping them build a recovery foundation, while also having a peer recovery specialist that can provide that mentorship and really explaining to them, I've been there, giving them that feeling of like they're not alone and really holding that hope for that client that they can do bigger and better things and also have recovery, but also having case managers as well within that same team to help them identify anything that they need within their service lines. That could include helping them find jobs, helping them identify how to manage their mental health in a healthy way when they're having symptoms versus using substances. It'd be helping them develop relapse prevention planning. And so that's why a multidisciplinary team is really important to help effectively treat both the mental health and substance use side. So that way the whole person is being treated and not just parts of the individual. So this could look very different, as I said before, based on their level of need. And so they may need inpatient residential. Maybe their mental health symptomology is really impeding on their daily functioning, and they really just need some inpatient stay to get stabilized on medication. Maybe they have some suicidal or homicidal ideation that needs to be regulated. But also maybe their substance use disorder is at a level with like alcohol and benzodiazepines, which could be life-threatening when they go into detox. They could need detox as well to help make sure they are medically well as they come off of the substance. And so once they get done in an inpatient level of care, if that is what is indicated, they could go into outpatient treatment. And so outpatient treatment can have many different ways, as we talked about before in the multidisciplinary team, of what we're providing to them. So that could be behavioral health therapy, individual service line, and or the group setting. So really utilizing cognitive behavioral therapy, helping them with motivational interviewing. It could be providing them with solution-focused therapy, really helping address what the individual is needing in that time. It could be trauma treatment, EMDR. So very many different ways that we could treat that individual. Medication management, as I spoke about before, is a really big piece that could go into someone's recovery when treating their dual diagnosis, helping them get connected to support groups out in the community so they have that community connection. So when they complete treatment, they continue to have natural supports outside of professional. Also, relapse prevention is really key in helping someone with dual diagnosis treatment so they don't return to old patterns and behaviors that's going to exacerbate either the substance use disorder and or the mental health. And then also helping them have follow-up care. What are they doing to maintain their long-term recovery and making sure that they are connecting themselves to their treatment that they need, as well as maybe they need to stay in treatment longer than others just so that they can maintain. And so that's just remembering every single time that we need to treat both at the same time.
Integrating dual diagnosis treatments for individuals with both mental health and substance use disorders is essential for achieving comprehensive care, improving outcomes, and enhancing quality of life. By addressing both conditions simultaneously, healthcare providers can reduce relapse rates, accurately diagnose symptoms, and offer tailored therapy that meet the unique needs of each individual. This approach ensures continuous support, addresses root causes such as trauma, and promotes better health and social functioning, ultimately leading to lasting recovery and improved overall well-being.
And here are some our references that we utilize and some ways that you can connect and maybe find further information on how to treat someone who has mental health and substance use disorder and making sure that we are linking those two together.